This is Dr. Angelina. We are going live. I'm waiting for more people to join, but this is part 4, me reading a book for you guys that you asked me to read. This is a little brochure really by Dr. Neil Rosier. He's an expert in hormone replacement, and this is a good informational brochure. My patient asked me to read it for you. I'm doing it in sessions. It's a small 45-page little brochure, but we did part 1 that was more like introduction and what are the hormones kind of thing. We did part 2 and thyroid hormone. Um, we did part 2, which had the thyroid hormone in it. We did part 3, which had estrogen conversation and information. I do them in about 20-minute sessions. That way you guys can listen. Obviously, my patients will get a book from me or a PDF file of this so they can read it. Those on TikTok watching live, you can always join the stream in YouTube, or later on go back, follow the channel, click like, share on IBI Healthcare Institute YouTube channel. So, and then after I'm done with the YouTube live, I will go ahead and switch to TikTok for questions. Hope this helps. Hope everyone's staying safe and dry during the hurricane. And we'll get started. So today, topic progesterone. That starts with a quote. The only time I felt normal was when I was pregnant. Otherwise, I was miserable 1 week of every month. Now I feel great on progesterone. No more PMS, no more headaches, bloating, or cramps. Finally, I'm back to normal. So that sounds like a very common thing the patients say, that during pregnancy, a lot of the symptoms that we have go away. Why? Because we have a huge progesterone production. And then when that progesterone disappears, guess what? It's back to down. So let's read about progesterone. Women in menopause lose progesterone, which protects against uterine cancer, breast cancer, osteoporosis, and heart disease. Unfortunately, most doctors do not replace the lost progesterone with progesterone, but use synthetic, chemically different drug called medroxyprogesterone. I'm trying to say it slowly, but it doesn't work when I try to break it down on the syllable. So medroxyprogesterone is a synthetic version, or the brand name Provera. Even though Provera shares a similar name to progesterone, medroxyprogesterone, it is molecularly and biologically different than bioidentical progesterone. This section explains how Provera is so problematic and harmful, and how progesterone is so safe and beneficial, even though most physicians think that they are the same thing. So remember, we talked about it during part 3. Do not compare or draw conclusions between synthetic estrogen and bioidentical estrogen, estradiol. We should do the same with progesterone. Do not compare them. Do not equate them. They are not the same. Progesterone stands for progestational, or hormone of pregnancy. It is absolutely necessary for the initiation and maintenance of pregnancy. Provera, a progestin or synthetic progesterone, is a teratogen. Teratogen is any medicine, any compound that can cause birth defects and is absolutely contraindicated in pregnancy. You see the difference? So natural bioidentical progesterone is pregnancy hormone. We make crap load of it during pregnancy, and it is the synthetic form of it. Provera is a teratogen. We can make the baby have birth defects, right? That's why we cannot compare the side effects of those two. Obviously, these hormones are opposites of each other and are structurally, metabolically, and physiologically 2 completely different hormones. Most physicians, however, do not comprehend this and will therefore prescribe Provera. They should not be used interchangeably. Almost all medical studies evaluate only the synthetic progestin, Provera, and have found Provera to be harmful in many ways. The medical studies evaluating natural progesterone have never found to be harmful. Most physicians do not understand the difference, and even the medical literature does not clearly differentiate between progesterone and Provera, which is medroxyprogesterone. So it's a little confusing, but again, in this chapter, he's comparing synthetic versus non-synthetic, bioidentical good, synthetic bad, and so on. You guys on TikTok, you can click that like button if you like. You can tap the screen. And people on YouTube who's watching it, make sure you click the like and share button and definitely follow the channel. It has a lot of good information on it. Progesterone is another female hormone or equal importance as is estrogen for the aging woman, although it is commonly overlooked. Progesterone is a hormone produced by the ovaries and is used in nature to balance estrogen. It too can safely and effectively relieve menopausal symptoms, protect against cancer, prevent osteoporosis, and improve overall well-being. In the past, physicians had been accustomed to prescribing the synthetic progestin, brand name Provera. This synthetic progestins cause significant problems and side effects, as do the synthetic estrogens, and do not provide the benefits produced by natural progesterone. The recent study cited in JAMA, July 23rd, 2002, that's obviously an older writing, but there were other studies too, was a large hormone study utilizing different combinations and forms of estrogen and progestin. And remember, progestin is not progesterone, different names. A portion of the study was terminated early because of statistically significant increase in incidence of breast cancer. This WHI study demonstrated that it was actually the progestin, Provera, that was responsible for the increased incidence of breast cancer, even though estrogen is thought to be the culprit. A most important but not widely published fact is that estrogen-only arm of WHI study demonstrated a decreased incidence of cancer. Estrogen is not to blame. Progestin, Provera, clearly is the culprit. More importantly, recent studies consistently demonstrate that progesterone, the bioidentical progesterone, protects from breast cancer. There was no problem with Premarin or the estrogen-only arm of the clinical trial, the WHI. The media either misrepresented that all hormone replacement is risky or that Premarin was the problem. The media also stated that progesterone was the problem, which was also incorrect because Provera is not progesterone. It is progestin. Again, the progestin Provera is not the same as progesterone. The confusion stems from the fact that genetic name Provera is medroxyprogesterone, which doctors interpreted as progesterone. However, progestin Provera and progesterone have completely different molecular structures and are physiologically different. Progesterone has no harmful effects, whereas progestin is riddled with problems. Unfortunately, neither the media nor the public understands the difference, even though the medical literature provides and proves them to be entirely different. They definitely are not the same. So again, this is comparison between synthetic progestin and natural bioidentical progesterone. Media, when that WHI study information came out, blew it out of proportion, misinterpreted studies. The study been debunked multiple times by multiple much larger studies, but that information continues not to be translated back into the medical literature. And even the black box warnings that we have on all the hormones across the board, they took it from this misrepresented study and applied it to all the hormones no matter what, and that's wrong, and that scares a lot of people. Natural progesterone enhances the action of estrogen, as these two hormones were meant to work together to maintain normal hormonal balance. The lack of progesterone causes similar disease processes as does lack of estrogen. This include osteoporosis, heart disease, decrease in libido, and significantly diminished quality of life. The combination of natural progesterone and estrogen can prevent the downward spiral by keeping the woman vital, strong, and healthy. So as we know, post-menopause, everything just goes, don't sleep well, brain fog, bones get weak, muscle gets weak, head hurts, migraine headaches, adult onset asthma, vaginal dryness, urinary tract infections, bloating, gaining weight in midsection, the visceral fat, right? All of those things start happening at perimenopause, menopause. Those two hormones can really help us, but a lot of doctors are still not sure how to prescribe them, how to manage that, and they get very confused by that. Most women complain of many side effects of synthetic progestins and now demand the natural progesterone supplementation instead. Studies have shown the tremendous health benefits of natural progesterone. However, it is usually prescribed only at the instance of well-educated, well-informed women. Natural progesterone allows women to feel much better than they do on any of the synthetic progestins. We used to explain how the synthetic progestin caused bloating, swelling, breast tenderness, bleeding, and depression, whereas the natural progesterone does not. Now that we have such strong evidence that Provera causes breast cancer, it seems meaningless to even debate the synthetic progestins should ever be used. Anyone that continues to prescribe or take Provera or synthetic progestins is taking a risk they don't need to take. Natural progesterone should be the definite choice due to protective benefits and no side effects. And there's a good question, which I will go ahead and address even though I'm reading the book. Is there a requirement to start by a certain age or time with menopause? So best idea to start some of the hormones in perimenopause, which is before you actually hit official menopause, and then add on the remaining hormones like estrogen after the menopause. The closer to menopause you started within first 10 years of menopause, the more protective it will be, but you can start it at any age after menopause. You might not benefit from protection right away because by the time you're 65, you already have cardiac disease, you already gained the weight, you already potentially have osteoporosis or osteopenia, and therefore you didn't get a chance to get that protective effect of the hormone at that point. You can try to catch it whenever you're able to at any age and continue to take hormones to make yourself feel well and continue to protect yourself, but it does not mean you already did not develop some underlying disease. So the earlier, the better, and hopefully within the first 10 years of beginning of menopause. Ideally, we should be offering it to people like right away. Why wait 10 years to start it, right? Even though natural progesterone is better for women, the medical community still has little knowledge of this. This is probably because natural progesterone cannot be patented and therefore it's not produced by pharmaceutical companies, right? Natural substance cannot be patented because they did not invent it. Natural progesterone is available commercially as Prometrium in a capsule form. We prefer progesterone in a sublingual form from compounding pharmacies because of better absorption. However, both sublingual and capsules work well to achieve therapeutic levels. Progesterone in cream form is not well absorbed. It is important to do blood tests to ensure levels are optimal. Natural progesterone is a very beneficial treatment for premenopausal syndrome, PMS, which includes moodiness, irritability, bloating, and headaches. Raise your hand if you ever had that. The symptoms are due to falling progesterone levels. Natural progesterone helps to balance both premenopausal and postmenopausal levels of estrogen and hormone-induced symptoms such as emotional instability, headaches, and mood swings. The natural progesterone has a mild tranquilizing effect and effects of overall well-being. Natural progesterone also offers protection against uterine cancer as well as breast cancer, as evidenced by European studies, whereas Provera increases breast stimulation and breast density as seen on mammograms. So remember again, he's comparing natural versus synthetic. 2 recent Japanese studies showed how progesterone prevents breast stimulation, whereas Provera does not. A different study showed that progesterone was better than tamoxifen in protecting against breast cancer. This is an extremely important study because up to this point, there has been nothing shown to decrease the risk of breast cancer. Progesterone inhibits growth of breast cancer cells, whereas progestin stimulates growth of breast cancer cells. And that's from European Journal of Cancer. Progesterone levels are high during pregnancy and are essential in carrying baby to term. These high progesterone levels are often responsible for women reporting how great they feel during pregnancy and why many symptoms associated with PMS disappear during pregnancy. It is a sudden decline of progesterone after giving birth that causes postpartum depression. Treatment with natural progesterone is the post in a postpartum period can help new mothers cope with their hormone rebalance. Natural progesterone also results in a greater reduction of cholesterol levels and an increase of HDL, which is a good cholesterol. This is in contrast to synthetic progestin, which does the opposite. Unfortunately, the overwhelming majority of physicians who write prescriptions for progestin are unaware that there is a safer option, better tolerated progesterone that is available. In addition, the natural progesterone has been shown to halt progression of osteoporosis. Progesterone stimulates osteoblasts, which are the cells that grow new bone. Estrogen will only prevent bone loss. So that's why we need to have both estrogen and progesterone after menopause, even if you don't have uterus. A lot of doctors will say, oh, you had a hysterectomy, you don't have the uterus anymore, therefore you don't need progesterone. But wait a minute, progesterone does other things like stimulating bone growth, which we need. We don't want to just not lose bone, we want to make new bone. Our bone is never the same. Our bone, for those who did not know, is not the same bone right now as it was 10 years ago or the one you were born with. It's been replaced so many times. It's constantly breaking and making. We constantly replenish and remake our bones. And as we get older, we start losing more bone that we make, and that's how we get osteopenia and osteoporosis. But with progesterone, we can make new bone. With estrogen, we can prevent the bone loss. So you want to have both estrogen and progesterone in your system as you get older. For those women who are unable to take natural estrogen, natural progesterone can be prescribed to treat many of the common symptoms of menopause and prevent the diseases associated with menopause. The PEPI trial evaluated the use of estrogen and Provera, or estrogen and natural progesterone. The Provera arm of the study showed that those women had an increased risk of heart disease and elevated cholesterol levels. The natural progesterone arm of the study resulted in less heart disease and lower cholesterol levels. This study was completed years ago. No wonder the recent July 2002 JAMA study showed that Provera increased the risk of heart disease. Why do researchers continue to use progestin when numerous studies already pinpoint significant problems? So where they had previous studies showing progesterone is good, Provera is bad, they keep using it. Natural progesterone comes in many forms, most commonly topical creams and the oral capsules and the sublingual tablets. In my experience, which is the writer here, who I'm reading, the best bioavailable form that results in sustained therapeutic levels is the sublingual form. Over-the-counter progesterone creams contain a minimal amount of progesterone and will not bring blood levels to therapeutic ranges. Proponents of progesterone creams claim that saliva testing proves the efficacy. However, if you take the same patient with saliva testing and check their blood levels at the same time, you'll get completely different numbers. That's my own information. So let's see. Oh, what's my spot? So saliva tests do not correlate with blood tests. Blood tests are the true indicator of progesterone levels that is sufficient to be protective of the uterus, breast, bone, and heart. Adequate levels are attained through the use of prescription dose. If the over-the-counter creams had adequate doses, the FDA would require that it be dispensed only by prescription, as with all the drugs. Progesterone levels should be measured by blood tests and then evaluated by physician to assure that the levels is within the therapeutic range of 10 to 20 milligram per deciliter. So we have therapeutic ranges that we want to achieve in the blood. In summary, natural progesterone protects against breast cancer, is a natural tranquilizer, promotes feelings of well-being, enhances the beneficial actions of estrogen, relieves menopausal symptoms, and stimulates new bone formation, as well as protects against osteoporosis and cardiovascular disease. Provera does not do that, none of that. Purveyor is the synthetic stuff. Even if a woman does not have uterus, all should take progesterone for the above benefits found throughout the body, not just the uterus. Recent studies have demonstrated the benefits of progesterone in protecting against breast cancer. No other therapy has demonstrated this, even tamoxifen. Tamoxifen, there is no actual clinical trials to show that it protects from breast cancer. Progesterone does. All menopausal women should be taking progesterone, period. No pun intended. I think I will leave part 4 on progesterone as is, 20 minutes, as I promised. Then we'll get to the next chapters, which will be bleed or not to bleed. That's an interesting conversation. There's a lot of misinformation about it. Then we're going to get to testosterone for men, testosterone for women. Then we're going to go into some other ones like DHEA, melatonin, and a summary. So I think we're probably going to have 1 or 2 more videos in this series. All the other ones are already posted. So we have part 1, part 2, part 3 already posted. This is part 4. Make sure you click the follow button. Follow me on the IBI Healthcare Institute YouTube page. Click follow and like. And we will pick this up again with part 5. And then you guys can ask me all the questions and we'll go from there. Thank you.